Hello everyone and welcome to this evening's patient and public information webinar called Psoriasis, Community and Me. We are delivering the webinar here from St John's Institute of Dermatology in London, and it's a collaborative event between St John's DermAcademy and the Psoriasis Association. It follows the Psoriasis Awareness Week, which started on the 29th of October and finished on the 3rd of November. And the theme of Psoriasis Awareness Week was community. And tonight we continue this important conversation, and we will be exploring a number of themes, including psychological strategies to help with psoriasis when psoriasis impacts particularly your sleep. We will be hearing from Dr. Catherine O'Leary, who's a psychologist, take us through that. We'll be hearing from two of our highly specialist pharmacists, Arlene, McGuire and Clare Szlumper, telling us about getting the most out of your treatments. And then we'll be hearing from Dr. Manpreet Sagoo, our research fellow, about how care could look in the future. We would ask, please, not to video or record tonight's event, because we're doing that behind the scenes. We will share the recording in a few days' time on the Psoriasis Association's YouTube channel. And tonight, you'll hopefully be able to see us clearly and hear us clearly, but we can't see or hear you. If you would like to send in questions, and please do, whenever they pop into your mind, just write them into the chat. We'll be looking and reading all of these questions as they come in, and we'll be putting them to our panel at the end of the evening when we have our question and answer session. We'll do our best to answer as many questions as we can. And just to flag, please do support the amazing work that the Psoriasis Association do and enable them to continue their vital work. The website's listed there, or you can scan the QR code to find out more. In order to make this evening a bit more interactive, we are going to try to use this website called Mentimeter. And we'll be posing you a couple of questions, and it's a way for us to hear your thoughts as we go through the talk on our community pharmacists. So if you could go to www.menti.com and type in the code, which is 18372599, it just means you can be part of the conversation. So hope that works for everybody. And without further ado, it's my pleasure to introduce Dr. Catherine O'Leary. Hi, Catherine. Let me just end that and stop sharing. Great. So Catherine is a consultant clinical psychologist who is working in Cardiff in South Wales, and she leads the psychology service at the All Wales Adult Cystic Fibrosis Service. Now, we're absolutely delighted and honoured to have Catherine speak today, because she's actually lived with psoriasis since childhood, and recently written a book called Coping with Psoriasis, in which you share your journey with it. So it's our real pleasure to be able to hear about your journey with psoriasis and your insights from both a personal and professional perspective. So thank you very much, Catherine.
Thank you. I'll just share my screen.
That's great.
Yeah, okay, great. So thank you for asking me to speak this evening. I'm really pleased to be here. My name's Catherine. I'm a clinical psychologist and I live with psoriasis. And I'm going to talk today about psoriasis and sleep and my own experience of that. So this is me back in 2007. In the one photo, you can see me with my two sons. They were 4 and 2 at the time. And if you can see in the other photo that I was quite heavily pregnant with my 3rd child. And I was feeling pretty happy and confident about it all. My boys were busy, but they'd always slept really well. And I was thinking I'd really got it cracked as a parent. And then my daughter was sent to me, I think, as a lesson in humility, because unlike my boys, she did not sleep, and none of my tricks worked. It was really hard to settle her, and I had sleepless nights that went on for months and months. But at the same time, my psoriasis really flared up, and it had done the same after my boys were born. Um, you can, if you look at this photo, you can sort of see it's breaking out on my forehead, but I was covered in plaques, and they itched intensely at night. So on the rare occasions when she was sleeping, I would be laying in bed awake, scratching and stressing about how I would manage the day ahead. And it soon became a bit of a vicious cycle. I became more and more sleep deprived, the itching increased. I got less sleep, my symptoms flared up. I started to adapt what I was doing during the day. So I was eating sugary food and junk food for energy. I was skipping putting on my creams, and there was no time for exercise. Um, and on top of all that, I had a crying baby. So on top of the itch, uh, my baby was keeping me awake. And on top of all that, I had all the other things going on in life, the other life stresses that had an impact on my stress levels too. And it felt like things were getting worse and worse and worse. So what's the problem? Well, as a psychologist, I know that our sleep is fundamental to both our psychological and physical health. It's linked with mental health problems, both as a cause of mental health problems and it's also a symptom. And we know that chronic sleep deprivation increases your risk of health problems like obesity and diabetes, and it affects your immune system functioning. And it won't be a surprise to anyone that sleep deprivation is linked to memory and thinking problems. In fact, driving on less than 5 hours sleep is as dangerous as drink driving, and a quarter of all serious and fatal road traffic accidents involve sleep deprived driving. Um, and this is especially relevant this time of year. The clocks have just changed, but back in the spring, when we lose an hour of sleep, there's an increase in the level of heart attacks, 24% more. And conversely, when the clocks change in the autumn and we get an hour extra sleep, there's a reduction in heart attacks. So there's serious implications of sleep deprivation. But most of all, as I'm sure most people watching today will know, lack of sleep just feels horrible. You feel you can't cope, you can't function, and you just feel pretty miserable. So what do we know about psoriasis and sleep? Well, my situation's not unusual. So lots of us, in fact, around 60% report sleep problems. And similarly, a lot of us have less than the recommended amount of sleep even when we are sleeping. And it's things like our symptoms like pain and itching all impact sleep. But it also seems that lack of sleep affects psoriasis and makes things worse for our skin. So people who are sleep deprived and have psoriasis have an increase of comorbidities like cardiovascular disease. And we know from research looking at night shift workers that they're more likely to get psoriasis. And when they have psoriasis, they're more likely to have worse flare-ups. And there's also evidence that sleep dysfunction contributes to chronic inflammation, which adds to the whole picture. So I'm a psychologist, and I work with people who have sleep problems, and I know that the first go-to is sleep hygiene. And this involves improving your conditions for sleep, like not drinking caffeine before bed, not looking at your mobile phone, and having a good bedtime routine. And all that can be really, really helpful. But for me, it wasn't especially helpful because I had a crying baby and I had itching skin and my joints hurt. So it wasn't the answer for me. So I had to think about a little harder about what might help me improve my sleep. So I know there are psychological factors linked to sleep problems. The first is that what we call the paradox of sleep effort. And what that means is when we try hard to do anything, including going to sleep, we're actually telling our brain that it's time to go into work mode because there's a problem to solve. So the brain activates itself and we become more alert and more aroused. And the problem with this is that alertness and arousal are incompatible with sleepiness and falling asleep. So that means by trying hard to sleep and trying to get everything right, I was actually making it more difficult for myself to fall asleep. What I found most helpful was reminding myself um, that there's evidence that the lack of sleep makes things a whole lot worse. So I knew that my worry wasn't helping me. So there's studies done on people looking at sleep, and they found that there's a group of people they call complaining good sleepers. So these are people who think they sleep well, but when you put them in a sleep lab, they suffer from, they do have insomnia, but they don't believe or realize that they do. So these non-complaining poor sleepers don't experience distress or anxiety, and they don't report daily fatigue. So there's another group as well who think they have insomnia, but when you study them in a sleep lab, they actually sleep normally. And these are more likely to experience high blood pressure, fatigue, anxiety, and depression. So it seems there's something about insomnia identity. So what you think your sleep is like, and that's more predictive of impairment than actual poor sleep itself. So this is the cycle I just showed you. But in actual fact, it was a little more complicated. So my worry about not sleeping, which you can see here, leads to the production of adrenaline and cortisol. It makes me stressed, and that actually activates my brain. And this was leading me to feel more awake and making it harder for me to switch off. And research actually tells us that worrying about not getting enough sleep can itself lead to prolonged insomnia. So what could I do? So I knew that the psychological strategies I could use would be reminding myself about the facts about sleep, using techniques to reduce my worry and address my unhelpful thoughts, and using relaxation. So what were the facts I needed to know? So I reminded myself about sleep. So we go through several sleep cycles each night, from lighter sleep to deeper sleep, and we spend less time in deep sleep as the night progresses. And for all of us, there are moments of awakening that happen just next to the REM or dream sleep. A lot of the time, we fall asleep so quickly that we don't remember this. But if we're concerned about sleeping, we actually might wake ourselves up properly during those moments by worrying. So I reminded myself that actually it's normal to wake during the night. And in fact, most of us wake up 2 or 3 times in the night for varied reasons, and that's considered a normal part of a normal sleep pattern. I also reminded myself that I was doing much better than our ancestors. So years ago, people shared beds. The beds were uncomfortable. They may not have had beds at all. There may have been things like bed bugs and cold rooms. So my sleep environment was already much, much better. And in fact, in the Middle Ages, it was common for people to sleep in 2 phases. So they would go to sleep at sundown, and then after a few hours sleep, people would tend to wake up for a few hours or an hour or so to eat, pray, to look after animals or tend to fires. And then they would go to bed for their second sleep. And actually, this only changed after the Industrial Revolution. So I reminded myself that this idea that I had to have a block of perfect sleep was perhaps not right. And finally, I reminded myself that when you put people into sleep labs, they are very bad at estimating how much sleep they're actually getting. So there was a good chance I was doing better than I actually realized. So knowing these facts helped me reduce my worry. So the next thing I tried was practicing mindfulness, which is a type of meditation to manage my worries. So it's a form of meditation where you focus on the here and now. So I would practice this regularly during the day. I'd find little moments like when I was waiting for the kettle to boil or while I was in the shower, and I would practice bringing my attention to the here and now. And I also bought a CD that had mindfulness exercises for children, and I practiced with my boys. So what all this practice meant was that in the night, when I woke up and I was worrying, or I was scratching and I was worrying, I could practice mindfulness much, much easier because I was used to doing it. So instead of getting caught up in my worries, I would focus on the here and now. I wasn't activating my brain or starting a stress reaction, and I was much more likely to fall back to sleep. And I also used a technique from acceptance and commitment therapy. So when I noticed I was starting to worry about being awake and telling myself I'll never cope tomorrow, I'll crash the car and so on, what ordinarily would happen was one worrying thought would lead to another and to another, with me getting more and more stressed. So instead, what I would do was visualize a stream, and I would visualize leaves floating down the stream. And as a worry came up, I would just visualize taking that worry, putting it on a leaf, and letting it float away. And what this allowed me to do was distance myself from my thoughts and stopped my body responding to them as if they were actually happening right now and waking myself up. So just to summarize all that, psoriasis can affect your sleep. Poor sleep can have lots of negative impacts. It's very easy to start a vicious cycle when you start to worry, but regular enough sleep is important. But it's important to remember that how we think about sleep is important, and worrying about sleep, lack of sleep, makes things a whole lot worse. And there's lots of good evidence that psychological strategies like these I've described can and do help. So if you wanted to read more, you can find um, descriptions of acceptance and commitment therapy and mindfulness in my book, Coping with Psoriasis. And I also have a website, which is copingwithpsoriasis.com. And if you go to the resources section, it'll take you to some great sleep resources, which are available online, some of which are free and some of which are available through the NHS. And you can just follow that QR code to take you there. So luckily my daughter started sleeping. This is her sometime later, and she's a very good sleeper now. So those strategies and techniques that I used then, I still use from time to time now when my skin is itchy, and they still continue to be helpful to me. So thank you for your time this evening. Diolch yn fawr.
Thank you so much, Catherine. That was fantastic and incredibly valuable practical advice for everybody. So thank you very much. There's been lots of questions coming through, but we're going to save them to the Q&A session at the end. So hopefully you'll be able to come back and join us for that. So thank you very much, Catherine. So next, it's my real pleasure to introduce two speakers who are going to work together to present the next section. So thank you very much, Arlene and Claire, for joining us today. So Arlene McGuire is a specialist, a highly specialised dermatology pharmacist and independent prescriber who works with us here at St John's Institute of Dermatology and leads the team of pharmacists here. Arlene's had a long-standing specialist interest in psoriasis and has made huge contributions to local and regional protocols that we use for prescribing here, and also the British Association of Dermatologists guidelines for biologic therapy in psoriasis. And Claire, thank you so much, Claire, for joining us. So Clare Szlumper is the lead pharmacist at the Upper Calder Valley Primary Care Network and is an independent prescriber. So Claire works currently across 2 GP practices and has previously worked alongside myself and Arlene here at St John's. So it's great to have both of you here today, and you'll be telling us how to get the most out of your treatments, and particularly with community pharmacy in mind. Thank you very much, both.
Yes, yeah. Share.
Sorry, just getting the screen up.
Present.
That's great. Exactly.
Thank you so much, Satveer, for the introduction. So as you mentioned, me and Claire worked together many moons ago, and it's been really lovely to be invited to come back and speak together, actually, because we both have this passion for supporting the care of patients with psoriasis. And hopefully we can tell you a little bit more about how your pharmacist can support you with that today. So we thought we'd get you to do a little bit of work for us first. We really wanted to hear from you who supports you with your psoriasis. So who makes up your psoriasis community? There is a QR code there, and I think Satveer shared the message at the beginning with the number. So we'd really like to have some responses from you. This may go completely wrong, but you know, is it healthcare professionals? So is it doctors, nurses? But equally, is it members of your community, your family? Is it the Psoriasis Association? Is it charities that you come in contact with, or support groups? Just to get a sense, I think, yes, definitely family members are absolutely key. Mums are very well versed in applying creams and treatments and knowing what appointments are going on. Really nice to see a pharmacist flashing up there, thank you. Celebrities, that's a really interesting one, actually. I think more and more we are turning to social media and getting information from people on there, so that's interesting. Friends, really key. Psoriasis Association is involved there, so that's really good to know that people are accessing support through them. Great. And NHS consultants, GPs, brilliant. Lovely. Thank you so much for contributing to that. So we'll keep that going, but equally, we're kind of keen to know who does have a pharmacist within their psoriasis community. So next question, you won't be thrown off the webinar if your answer is no, so don't worry, but we're just interested to know if you have a community pharmacist or a pharmacist in some form that supports you with your care. Interesting. Okay, great. So that leads us on, I think, to say, or to tell you a little bit more about maybe how you can access a pharmacist to kind of support your psoriasis care. And I'm going to hand over to Claire.
Thanks, Arlene. So you may not know that you have a pharmacist as part of your psoriasis community, but if you have any medications dispensed at all for you, whether that's creams or oral medication, if you buy any creams from a pharmacy, then yes, you do have a pharmacist as part of your psoriasis community, which is great because we're a really readily available resource. We work in a number of sectors, so you've got your community pharmacists that work in the high street shops that you can all walk into without any appointments. You've got people like myself who work alongside GPs in GP practices, and you've got people like Arlene who are the more specialist pharmacists who work in hospitals alongside the specialists you may be referred to in your psoriasis journey. And as pharmacists, we are experts in medicines. It's what we do. It's what we live and breathe as pharmacists. And increasingly, we're becoming much more involved in the care of people with skin conditions. And that's true for pharmacists in any sector of pharmacy where they work. So what I wanted to do is give an overview of what community pharmacists do and how you might be able to tap into some of the resources that they can offer. So as I've already said, community pharmacists are an amazing resource that you can walk into almost every day, depending on where you live, and without the need for an appointment, and ask for advice. They're trained professionals. We've all done the same pharmacy degree, and they're able to offer any advice on any medication. So whether you're having a side effect from it, whether you just want to know how best to apply your topical therapy, or what order to apply things, or what might be the best thing for you to buy or get prescribed, they should be able to offer some advice. They may not be able to answer all of your questions, and if they can't, hopefully they will then get in touch with your GP on your behalf. And if you're if you're getting medication from them already, and be able to signpost you to your GP that way. If you are a vulnerable patient, the community pharmacy will arrange for ordering all your repeat prescriptions for you, so you don't have to do anything, which is amazing. They can also deliver your prescriptions out to you depending on what service your community pharmacy offer. And community pharmacists are getting increasingly more powers to be able to independently manage patients without the need for seeing a GP. So there's lots of prescribing pharmacists that are now working in the shops in the community. So that means that they're now being given the powers to be able to change prescriptions if what's being prescribed for you is out of stock. And we know that stock problems and supply issues are endless at the moment, and it's really, really hard to predict what medication and what topical therapy might be affected. But the community pharmacies are really at the forefront of being able to give the most up-to-date advice on what's available and what they're able to order in, or how long a lead time might be from them placing the order from them receiving it in their pharmacy. So I'd really encourage you all, if you're using regular topicals or any medications for your psoriasis or other medications, to really get to know your community pharmacy and see what services they offer, because it does vary regionally and place to place. So yeah, so speak to them and find out what they can do for you. Next slide, Arlene, please. So I'll talk a bit about my role. So I work in a GP surgery, and officially my title is a primary care network pharmacist, which is a very fancy name for saying I work in a GP surgery. But what it means is that we provide service to various different GP surgeries in a locality, and everywhere in England has a primary care network. And every primary care network in England has a pharmacist or pharmacy technician working for them. So I work in a team of 9, and I work alongside different professionals within the primary care team to provide a holistic care to patients. So we work alongside the nurses in the Aging Well team, the physiotherapists, mental health practitioners, social prescribers, and acute visiting service, which consists of paramedics who will come and do a home visit if you're unable to access and make your way into a GP practice if you're acutely unwell. And we can, signpost you to all these different professions that work together within a GP, without you needing to book a separate appointment with them. We can organise those appointments for you if you end up contacting your pharmacist in your pharmacy team. So a big part of my role is making sure all the medications that your GP surgery prescribes is safe and is relevant for you, and it matches what's happening with you as a person right now. So we know that if you have a dermatological condition, you may be under a specialist, you may not be, you may be seeing a specialist GP, you may just be seeing your GP rather than any specialist service. But if you are under a specialist, what we do is ensure that all that information from your specialist is transcribed across onto your GP record. And if you do have a skincare plan, we make sure that that's up to date on your repeat prescription if appropriate, and have an accurate documentation in your medical record of what you might be needing if your skin flares. And I think the key message that I want to get out to you, to get the most of your pharmacist in a community, and also from your GP practice, whether that's a pharmacist or a nurse or a GP that you might see regularly, is to communicate with them what works for you with your skin, what amount of topicals you need. Maybe you're regularly getting small tubes of a topical, but actually you need a big one, and it's quite stressful trying to get in touch with your GP surgery order more each time. So if we can get it right from the very beginning, it's much easier for you, it's much easier for us, and we want to basically ensure a smooth transition of care between primary care and secondary care. Another big part of my role is regularly reviewing medication. So if anyone is on a repeat prescription, then they will likely have me calling them up or booking them appointments to sit with me in a room to discuss your medicines. And we also deal with medication requests. So I do all the prescriptions for the GP practice if someone's regularly on medications, and intermittent medication you might request. So it may be that you're requesting a topical that you've not used for a year. So someone like me might call you up and try to find out what's going on. Is your skin worsening? Is it just that you've had a tube of cream that's lasted you a long time and you've run out? But really want to get the most and ensure appropriate therapies being used, and try identify when you might need to see a GP versus when I can just give you a treatment without making you see a doctor. And as I said before, signposting you to other services. We know psoriasis isn't just treated with topicals or oral therapy, and we know that mental health practitioners have a huge role to play in well-being for people with skin conditions, and making sure that you're signposted to the right support that you might need, that can't be offered by a GP and can't be offered by a pharmacist, but it can be offered by someone with more specialist training in mental health. And I think that's all I've got to say at the moment.
So following on from that, I guess I couldn't let Claire take all of the spotlight for the community pharmacist. I thought I'd better let you know what we also do in the hospital. So some of you may be under a specialist service, a dermatologist in the hospital, and increasingly you might start to see pharmacists to repeat your medication if you're on a long-term medication. So we're usually trained as prescribers, and we prescribe medication, but we can also dispense and manage the supply of those medicines for you, whether they're delivered to your home, things like that. I guess a lot of the work is also in the background. So with psoriasis, we know there's been loads of new treatments coming through, which has been really interesting and exciting. And we're part of that journey and helping bringing those medicines to a clinical scenario so that we can actually use them. We are involved in writing patient information and guidelines and setting up pathways of care, and also referring you on where needed. So I think really both Claire and I wanted to just give you some really top level tips for getting the most out of your treatments. We know that everyone's human and it's not always easy, but generally trying to be consistent with your treatment plan. So stick to the plan if you've got one, and trying to create a routine around that. Again, we know that's really hard, but if your medicines are in a certain place where they're more likely to be used, if you keep all your creams in the bathroom or wherever you're likely to use them. For me, if anything's beside the kettle, I'll definitely be going there every day. So it's that kind of reminder to take your medicine. There's lots of apps and really good reminders. And especially if you're on an injectable treatment, that can be quite useful to just keep a diary of when you've injected and when you're next due. Being organised is really key. We know it's quite a burden for patients, having a long-term condition. There is a lot to keep up with, appointments and ordering your repeats, but I guess just trying to come at that, in an organised way, storing your medicines appropriately. Do they need to go in the fridge? Do they need to stay at room temperature? Have you checked the expiry date on them, or have you been using that tube of cream for a year, like Claire mentioned? And just putting in your repeat prescription requests in time just helps to all avoid hiccups with your treatment. If you're travelling, we can offer advice on, how to store your medications, how to travel with cold chain injectables, or provide a letter to help explain that you're travelling with medicines. And I think a key thing for all of us is just communicate with us. We're very happy for questions, and we really want honest feedback. So if that cream is too heavy or too thick or too greasy, or, we can advise on different formulations. If what we've asked you to do is just too many steps and too much to keep up with, we'd rather honest feedback so that we can really tailor the advice for you. Keep a track of your own progress. So let us know what's working and what's not working for you. Some people find it helpful to keep a little diary of knowing what things are are going well and what sort of seems to trigger their psoriasis. Realistic goals is really important. So we want to know what's important to you in order to create or give you the best treatment plan. So is it that you need your face to be clear because you're getting married? Is it that you need your nails to be clear because you need your hands are very much part of what you do at work? Or is it, like Catherine said earlier, that the itch is driving you mad and you can't sleep? So all these sort of things about what's important to you helps us decide on the best treatment for you and how to get the most out of that treatment for you. And please do ask us about the timeline. So how quickly can you expect your treatment to work? When will the creams kick in? When do you need to go back if they're not working? When do you need to seek advice? Or, that kind of thing can be really helpful for you to know. Please do ask for help. So like Claire said, we can signpost you to other supportive strategies. It's not all about the medicines, we know that. And actually, we need to look at this from a holistic point of view and make sure that you're supported in that way. Make sure you attend your follow-ups regularly so that you avoid breaks in treatment and blips in your therapy. And then just if you need more information, don't be afraid to ask. There's so many useful resources out there. And I think sometimes we either bombard you with too much information and give you too many sheets of paper or too many QR codes. And then other times we might not give you enough. So it's just about knowing what works for you and how you best like that information and what information is most useful for you, I guess. So that's just some general top tips. It's been really nice to attend today. We'll look forward to any questions at the end of the evening.
Thank you so much, Arlene and Claire. That was fantastic. A really thorough run through about how we can make the most of you both in the community and in the hospital. So thank you so much, and we'll see you at the end shortly. So it's my pleasure to introduce Dr. Manpreet Sagoo. So Manpreet is a dermatology registrar here at St John's Institute of Dermatology. She's currently doing a one-year research fellowship with us here at the university at King's College London, with a key aim to try to develop tools to predict psoriasis severity. And today, Manpreet will be sharing some of the research that we've been doing around how to predict those people with psoriasis who are at risk of severe disease. So thank you very much, Manpreet, for running through this with us. You just
sorry, I was muted. Thanks very much, Satveer. So thanks for the opportunity to speak today about the future of psoriasis care. I'm Manpreet, one of the dermatology registrars at the St John's Institute of Dermatology, and I'm currently undertaking a research fellowship focusing on psoriasis. So really delighted to share our work exploring ways to predict who will develop severe psoriasis and how this could improve psoriasis care in the future. So, as I'm sure many of you already know, psoriasis is a common skin condition that exists on a spectrum and affects people in different ways. For some, their psoriasis is mild and they might have good days and bad days, whilst others experience severe psoriasis, which can develop gradually or quickly. Now, 10 to 30% of people with psoriasis have severe disease, and this can have a huge impact on health in multiple ways. For example, having severe psoriasis can increase the burden of other health problems, such as heart disease, mental health issues, and directly impacts day-to-day life, from work to sleep, which we've heard about earlier in the webinar, to social interactions. Currently, when someone first develops psoriasis, we don't know what course their psoriasis will take over their lifetime. But imagine if we did. Wouldn't it be fantastic if there was a way to predict who was at risk of getting severe disease so we could take action early and give the right treatment to the right person at the right time, a more proactive and personalised approach? So there's exciting evidence from other medical conditions like rheumatoid arthritis, which affects your joints, and inflammatory bowel disease, which affects the gut, that demonstrates early action with the right treatment can improve the course of disease. And now we want to apply this approach to psoriasis as well. So to do so, we want to better understand why people develop severe psoriasis in the first place. And we're focusing on two main areas, so our genetic code and the environment. So let's start with the genetics. We already know a lot about the importance of genetics in psoriasis, but what is your genetic code? So our genetic code, or DNA, as you might have heard, will vary from person to person, and it's what makes us all individual. It carries valuable information about your family history, your ancestry, and your health. For example, in psoriasis, we know there's a strong family link. You might have a family member who's affected by psoriasis, and if you do, you're more likely to be affected by it too. And that's because you share parts of your genetic code. So what do we know about the genetic code in patients with psoriasis? Well, there are some medical conditions that are caused by changes in maybe one or two genes. However, psoriasis and other common medical conditions, like heart disease, for example, are caused by small changes across many genes. The combined effect of adding all of these small changes across these many genes together can determine your risk for developing a certain condition, such as psoriasis, and that's known as your polygenic risk score. So poly, which means many, genic, which refers to genes, and risk score, so to calculate the risk of developing a condition. Knowing your risk of developing a condition can be a really powerful tool to help lead a healthier life. Our team performed the largest genetic study in over 40,000 patients with psoriasis, and the findings are soon to be published, so watch this space. We developed a polygenic risk score specifically for psoriasis. The main finding from our study was that a psoriasis-specific polygenic risk score, so combining all the many genes involved in psoriasis, can predict the severity of psoriasis at a level similar to other environmental factors, really highlighting how critical your genetic code is. Alongside your genetic code, the environment also has a really important role in psoriasis, as I'm sure most of you know as well. So to better understand this, we launched the My Skin study. It's a UK-wide online platform launched in 2023 that allows people with psoriasis to report their experience. Among the My Skin community of 848 participants, so 62% of them are females, the average age is around 50 years old, and 86% have plaque psoriasis. We looked and identified common triggers for psoriasis onset and flares. So looking at psoriasis onset, the most common triggers were stress, infection, and skin injury, and these might be things that you can relate to too. For psoriasis flares, the most common triggers were stress, climate, and low mood. And again, these might be things that you've experienced as well. Lifestyle factors such as alcohol, smoking, and weight were also reported by our My Skin community. Ultimately, both the environment and our genetic code influences the development of severe psoriasis. And our goal is to understand this further, to really unpick the relationship between all of these factors so we can better predict who will develop severe disease. And so what could the future of psoriasis care look like? Well, through our research, we hope to build on this information to develop personalised and proactive tools to predict those who are at risk of severe psoriasis. And this is what the pathway could look like. So imagine a patient with psoriasis first presents in the community. Then, using a clever calculator tool, we're able to combine the clinical, lifestyle, and genetic information to predict the risk for severe disease. So finally, the third step that, for those who are deemed high risk, we can take action early, connecting them with the appropriate dermatology services so they can start the right treatment at the right time. Now, there are a number of steps that we need to take before we can reach this point, but it's an exciting prospect that could shift psoriasis care towards a more proactive approach. We're really excited to work closely with the psoriasis community to guide the development of these prediction tools and ultimately improve the lives of people with psoriasis. And we would love you to join us on this journey. We're actively recruiting patients to join the My Skin community to help us understand psoriasis better together. You can sign up. Sorry, I'll just go back to my last slide. You can sign up on the website address here, and we're also currently developing a mobile app, which is the exciting next stage of the study. So please do join us, and there's a QR code on the screen too. Thanks very much.
Thanks very much, Manpreet.